You have a fever or a cough, and maybe you've just come in contact with someone who has COVID. So you take a test and then you get this, you get a positive result. What do you do next? That's what we're covering in today's To Your Wellbeing. Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder, is joining us. All right, so this is a common question, and with the rise in COVID-19 cases recently, a lot of folks may be in that position. So what steps should people do if they test positive?
Well, the first and foremost is definitely the key part of this is to stay at home, right? That isolation aspect of it. And like other respiratory illnesses, stay hydrated. You can take some medicines for your fever, and then also probably it makes sense to have all your housemates or household members also get tested. And if possible, they probably should quarantine as well, because there's a good chance that you may have already transmitted the infection to them.
So staying home is the key thing to do first and foremost, is staying home and quarantining. All right, so let's talk about like e-visits for COVID. How do those work?
So that's I think the great part in a strange way of this pandemic is that it's really pushed the medical field to figure out how to best serve patients in the community. And so I think if you're feeling poorly, where you're starting to have a cough, or you can't feel comfortable, I think you can get a lot of call your primary care doctors, see if they can do a virtual visit with you. And then also, especially if you have risk factors to having a worsening outcome where you need to be hospitalized, it's a good thing to call your doctor to see if you'd be a candidate for some oral antiviral medicine, or maybe a monoclonal infusion. So most providers know how to get you referred to the right clinic in order to be evaluated for that treatment.
All right, but let's say you don't have a primary doctor. So how do you sign up for an e-visit with Cone?
So if you go to conehealth.com, there is a link for doing virtual visits.
Okay, so there's a link there so that you can do that virtual visit. Now, does that virtual visit take place of a test?
I'm sorry, say that again?
Does that virtual visit take place of a test?
Oh, it helps you. So if you already have had your results or need a results, they can get you hooked up to get one.
Okay. And so then what steps should people take to prevent that spreading to others? I know we touched on it at the very beginning for like all the different things that you should do, but let's go over that specifically, because so many folks are going to test positive and have other people in the house.
Correct. So the first thing is that if that was my scenario, I would go home, wear masks, and try to be away from the rest of my family, and then definitely have my other family members get tested, and then also have like close contacts. If I've worked with anybody within 6 feet and not have my mask on, they would be also potentially exposed. The thing that's really hard with Omicron and COVID in general, the 24 hours or 48 hours before you had symptoms, your viral load is pretty high. To that point, that's how you can infect others. So you should try to also tell the folks you've been with within the last 48 hours that you may have exposed them.
Okay, so 2 days worth beforehand. If you had lunch with somebody 2 days worth, and then 2 days later you get sick, you need to call those people.
Yes, that would be the best.
Okay, so how long should folks anticipate having COVID symptoms? It's changed since COVID, the first generation of COVID was out. How long should folks anticipate having that feeling that they're not feeling well?
It really depends on the individual. So people who are vaccinated tend to have very mild symptoms and a shorter course of feeling poorly. So there are folks, and what's interesting about Omicron, it's really an upper respiratory infection. Like people talk about more having bronchitis, very sore throat, sometimes laryngitis, nasal congestion, headache, and some of them have fever and fatigue, but they generally can feel better. I think the majority of people are feeling better like within like about 5 days of having your symptom onset.
All right, so then what signs may indicate to folks that they need to seek additional medical care? Like, is it that longer than the 4 days, or is it other symptoms that they would need to probably see a doctor or do an e-visit?
So I think anybody that's having like worsening shortness of breath, where they feel pretty winded, with doing their regular activity, to me that suggests that that it may be more advanced for you, and that makes sense to contact your primary care doctor for evaluation.
All right, and are there any symptoms that would warrant immediate attention, like you need to call 911 if you're experiencing this?
Yeah, so definitely if people are noticing that you are really having shortness of breath, where you're having labored breathing, where sometimes we notice people, they're using their neck muscles with a fast breathing rate. If they are not thinking straight, we notice people, if they're not oxygenating well, there may be some confusion. So all that, and obviously if there's any loss of consciousness, and if you are having sometimes there's also a lot of GI scenarios with this too, where people are having a lot of diarrhea and some nausea and vomiting. If you're so dehydrated, I think all that really requires you to seek emergency care.
Okay. All right, so let's say you're not fully vaccinated or boosted, but you get COVID-19. Do you still need the vaccination and the booster after you've had COVID-19?
Yes, I think it's still a good idea, depending on where you're at. And that's the scenario of if you haven't had your booster and you get COVID at the time period where you're supposed to get your booster, it's still a good idea to, after you recover, you can then go ahead and get that booster vaccine of whichever vaccine that's available for you.
Okay, and I don't think you mentioned this. How soon after having COVID can you get that vaccine or that booster?
We suspect that you probably have immunity for 90 days. But I think in general, a lot of medical providers say that once you've recovered, you should probably get the vaccine.
Okay, gotcha. All right, so Dr. Snyder is going to be with us until 6 o'clock. And so from here on out, she is answering your COVID questions. You can ask your question anonymously and get your question answered on the spot. Here's how you do it. You text us that question. The number is 336-379-5775. We'll be right back.